You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Brandon Chapek. Dr. Chapek, welcome to the program.
Thank you very much, Randy. Pleasure to be here.
Now, before we get into today's topic, lots of questions about dental implants.
Right.
Who's the typical dental implant patient you see?
For us, we're seeing two main categories of dental implant patients that are coming through our doors. Category number one, you have those people that have teeth that maybe have been broken down. Maybe they just have no idea quite what options they have. Feels like every time they've walked through a dentist door, they're told they have another problem. They need something else addressed, and it seems like it's getting them nowhere. They're just not happy with the teeth that they have, and they really don't know their options on it. Those are the people we can usually help the most when it comes to dental implants and a full set of new teeth. Give them a fresh start, give them truly all that function and ability to eat and chew and smile.
So that first group, they feel like, and we've talked about this, that they feel like they're headed to a denture.
Absolutely.
Is that right? And nobody wants a denture, right?
Nobody wants a denture.
But do they think that that's it for them? Like, well, my grandparents had them.
I could count, I'd need multiple sets of hands in order to count the number of times I've heard my grandma had a denture, my mom had a denture, my dad, their dog, whatever it might be, right? Everybody has this predisposed thing that they've been told their only option is going towards a denture, or they feel hopeless. They feel they have no other route to go. No matter what they've done in the past, what procedures they've done, how many doctors they've gone and seen, they're either told they don't have enough bone, they don't have the ability to have implants placed, there's no other option other than taking the teeth out. They're going to be heading towards subpar function. They've got a plate in their mouth. Here in Nebraska, that's what they always call them, a plate. They're plates. They're not dentures. They're going to be stuck with two plates in their mouth and not being able to take any of the food off of the plate in front of them.
So no more dentures, by the way, because I said that at the top of the show. Do you believe that? Is that the future of dentistry? Maybe 20 or 100 years from now, dentures as we know them will be gone. They'll all be attached to something.
Absolutely. I think that dentistry is heading towards giving you that third set of teeth, not a denture to replace it. You've gone through your baby teeth, you've gone through your adult teeth. There's no longer going to be a plate or a denture involved. It's that third set of teeth that's truly allowing you to function just the way you did with your natural ones. Now, the second group of patients that we see walk through our door, if we can get them through, are those patients that are already in plates or dentures.
Okay.
A lot of times we're having a hard time even getting them to realize options that are available to them simply because they're not going to the dentist. They've already had all their teeth taken out. They really don't see any reason to go in there unless, I've got a sore spot or they need some form of adjustment on those plates. Beyond that, they're trying to see us as little as possible. Those people, we can give them an upper and lower set of teeth that are fixed in place. They don't come out. That allows them to go eat dinner. It allows them to smile. It allows them to go about their life without having to be self-conscious or worrying about that piece of plastic that's in their mouth that's inhibiting their ability to live.
And how old can you be to get this done? Like, what's the upper age range?
Randy, I've got colleagues that are placing these implants into, I believe the most recent one I heard was a 99-year-old female that actually came in and had a full set of new teeth placed in, healed up great, and is running around, I don't know if we'd say skipping or what fully she's doing, but she's smiling while she's doing it.
Why would a 99-year-old want to do this?
99-year-old is going to want to do this for the exact same reason that you want to be able to show off your smile.
Okay.
Right? They want that confidence. They want to be able to go out, enjoy dinner. If they're maybe in a retirement home and celebrating, they've got family that decides to bring food in, they're not going to want to have to pass up on something that brings them true joy, that one recipe that their granddaughter's always been working on to perfect, trying to get it just right, just the way they used to make it. They don't want to pass up on being able to eat that. They want to be able to enjoy it and then smile about it without worrying about that plate flying out into the cake while they're celebrating their birthday.
Now, what if you have bad gums, like gum disease? I mean, that's why they're losing their teeth. Can they do it?
Absolutely.
Or the gums are too bad, they won't hold the implants?
Yeah, well, so this is absolutely the type of candidate we can help. Okay. We've got a gum disease that is taken off, that's reduced the amount of bone, reduced the amount of gum, compromised their natural teeth. We're removing...
Like it's an infection?
It's an infection. Okay. So at that point, you've got infection within the gums that's causing stability issues with everything else in the mouth. That's making those teeth loose. They're probably painful if they're moving around. Those gums are bleeding. They probably have some form of smell or bad breath that's associated with it. Okay. By removing those teeth, replacing implants and giving them a whole new screwed-in set of teeth, you no longer have that bad breath. You no longer have the painful gums. You no longer have those loose teeth.
Is that right?
It's pretty amazing.
Now, pain. They're numbed up, but you also do some type of sedation.
Yeah, so at our practice, we actually are giving a broad spectrum of different options. We always do local anesthetics, so there's no pain involved with it. You know, they're numb, they're comfortable. If they need a little bit more help, we can always go to laughing gas or nitrous oxide. The nice part about that is we're able to apply that, administer it, give them a couple minutes to kind of titrate up, get nice and comfortable, feeling like maybe they just had a couple glasses of wine with their friends. Just relax, takes the edge off.
It's nice.
We can reverse it out and they're able to drive home that same day under their own power. If you need maybe even an extra step, maybe the dentist really is not your favorite place to be, or you've got a little bit of trepidation when it comes to this procedure. We can do an oral medication that they take a lot of times the night before to allow them to get a nice rest.
The night before?
Usually I give it to them the night before. I want them rested, feeling good,
okay, good.
Ready to come in, you know, show off that new smile they're going to leave with, right? So we'll usually start them off the night before. We'll give them something, and then they'll usually take a second dose an hour before the appointment and bring a third tablet with them just to make sure if they happen to need a little bit extra during the procedure, it's available. We want to make sure that they're taken care of the whole way through. In those really extreme cases where there's really not a whole lot that they can handle when it comes to walking through that door of the office, you know, that's their biggest fear, is coming to the dentist. Those are the candidates that we help the most with IV sedation.
Okay.
So we're able to actually...
Is that safe?
Very safe. When it comes to IV sedation, you're looking at one little, you know, access into the arm, just starting one line, one IV. From there, I'm able to give, you know, a titrated dose that allows me to slowly progress the amount of medication we're administering.
Nice.
We're giving things that are taking care of pain, making sure that we're comfortable, we're relaxed. I usually do antibiotics and anti-inflammatories. All the post-op management stuff we're actually getting into the system during the procedure itself. And the best part, if we start to see them going a little bit too deep or going in a direction we don't necessarily want, we can just reverse things back out and bring them back down. Absolutely. I actually had one patient who was so scared to come into the dental office that she had put it off for over 35 years, since she was a teenager. Her getting through our front door was the first time that she had actually made it into an office in, I think, the last 15 years. So she had tried. She'd been coming in really trying to find you know, ways to take care of these teeth, but she was just so fearful after having a bad experience as a youth. We got her into the office. We were able to meet with her, talk her through, you know, some different options. IV sedation is the exact route that you want to go with somebody in that situation. She was thrilled to find somebody that actually offered it, because in our area there's not a whole lot of that available. So being able to give that as an option is huge. We were able to then get her to come back for the second appointment or the surgery appointment. That was one of those cases we actually did one of those oral sedatives the night before, because she told me straight up she was not going to be able to sleep unless we made sure that she was more comfortable. So we did one of those actually a little bit before. We actually had her take a medication or take a pill an hour before the appointment, so that she was able to actually get through the door. And then we actually were able to start in with IV titrated sedation, taking into account all the oral medications taken prior, so that you could just safely lower her into a comfortable state. So she walks out, or is wheeled out, and her ride takes care of her due to the sedation, make sure she's safe. No recollection of the procedure, but once the meds continue to wear off, all that she knows is she's got teeth locked into place, and she's going to be able to go to her favorite restaurant, which actually is one of the steakhouses in Lincoln. She wanted to go to Misty's, be able to chew on a steak. You know, she wasn't able to do it because a lot of the teeth have been broken down and were painful prior. Comes back for a 2-week post-op. She told me it was the best dental experience I never remember.
So what do they like more? The way it looks or what they could eat?
So I usually see patients come in that are solely concerned with wanting to have a beautiful smile. They want to be able to just look good when they're out with their friends. And it never fails. Those people, when they're looking to smile off at dinner with their friends and all those you know, social interactions, those are always ones that come back and say, you know, I was heading out, hanging out with the girlfriends, and all of a sudden I was able to eat my salad. I ordered a salad at dinner with my girlfriends and was able to eat it with a fork, just like I used to when I was younger.
So when you have bad teeth, I mean, it's tough to eat those type of things.
It can be very tough. A lot of times,
lettuce or whatever.
A lot of times when you have either bad teeth that are broken down, it might be painful to chew, they might be loose. It kind of prevents your ability to actually bite through the food or properly break it down. A lot of times it leads to, you know, diets that don't have full amounts of nutrients that you need. You're looking at just mashed potato based or high sugars or things like that. So you tend to see a lot of the cascade. I'm sure you've heard medical doctors talk about the diet in America. A lot of that actually can be combated if you have proper ability to chew, proper function. You're
For
able to
fiber, things like that.
Yeah, you're able to eat your fresh fruits, your vegetables, get the fiber in. You can't do that with bad teeth.
Okay, so they get their brand new upper and lower teeth supported by dental implants.
Yeah.
How soon could they eat?
They're eating the next day or that day if it's an early morning. Yeah.
Like they take it easy at the beginning.
Obviously, yeah.
And then before you know, so can they bite like a raw carrot with their front teeth once they're healed up?
Absolutely.
There's no restrictions.
No restrictions. You're back to a standard diet you used to be able to eat with your natural teeth. These are as close to functioning as you can find when it comes to a replacement option. These are your new teeth. You're not inhibited with what you can eat.
Okay.
You have your full diet back.
And we have to mention, I guess, how dental implants are typically done. Correct me if I'm wrong. You go to one place that does the surgery. You go to another doctor that puts the teeth on top and then maintained elsewhere. You do all three parts. Is that why you do things so quickly?
That is. So we do it all in-house, one location. People don't like going to the dentist, so the fewer places they have to go, the fewer visits they have to make, that's what they want.
Now you told me you have a digital setup where you're printing their upper and lower teeth in the other room.
Correct. While we're doing the procedure to actually replace the teeth, their new teeth are being printed right next door to where when they leave, we're able to take those teeth, screw them into place, they're walking out with their new set.
Is that right? Do you still hear that, by the way? No offense, doctor, because you're a big guy. We should mention you're 6'6", football player, grew up on a farm. Do people say, hey, no offense, but I can't stand a dentist? Or what do they say to you? Do you hear that?
Oh, absolutely. They never told you when you go through dental school that you're automatically everybody's least favorite person when it comes to any encounter in a room. So we get that a lot. But it also shows me that when you have those patients that can come in and you actually connect with them, you meet them as a person, and you're able to change their life with their ability to chew with new teeth and to function, and how astronomical of a change that is, it's pretty rewarding.
What's it like when you give them new teeth supported by dental implants and they see their smile for the first time in the mirror?
Most of the time when they see themselves, they break down. They can't believe that is actually their smile and those are their teeth. They're seeing themselves as the new them. It's the first moment of the rest of their life.
Now they're accompanied by somebody. Do their family member, spouse, whatever, do they get emotional too, like choked up sometimes?
Yeah, absolutely. We always have a nice stock of Kleenex, right in the office there, because the amount of emotion you see from family members seeing their loved one come out with this whole big bright smile and talking to them. And then I think also the biggest thing, those family members see the confidence change in that patient. Okay. That's really, really rewarding. Honestly, that's what we love the most at the office, is seeing that person go from, being subdued, not having confidence, not having a smile, just not fully giving you that twinkle that that they've held for years prior and they've had to repress it. I mean, seeing that come through, that's the most rewarding thing that you can see. And
now, as you call it, plates, right? Upper and lower denture.
Yeah.
But if you've been wearing a denture, let's say 10, 15, 20 years, you can't do this because you don't have enough bone. Is that true?
That's what they've probably been told, but it is absolutely not true.
Is that right?
Yes. So they might have found that answer if they would have gone to see somebody that maybe doesn't have proper imaging or more of the advanced surgery techniques that have come out recently. It used to be a very challenging process to try and find enough bone in order to place implants. Now we've got 3D imaging that allows us to pre-plan, map out a surgery, ensure that we've got proper implant selection to basically secure that denture to stable bone and provide function and the ability to chew and the natural teeth. I have countless patients that have been wearing dentures for 10, 15, 20, 30, I think even 40 years was the most that I had a patient with. We were able to give them teeth supported by dental implants, completely changed their ability to chew, gave them a whole new outlook on life, and it basically just changed their life.
Now, what about those patients that are in their 70s and they're on maybe blood pressure medications or diabetes medications? Can they do it?
Yeah, those people.
Or blood thinners, can they do this?
Absolutely. A lot of times that does require us to take a few things into account, proper management of the case, making sure that we're doing things with proper, medication, vacations, different approaches. But ultimately, we're seeing success.
You ever talk to their medical doctor if you have to?
Yeah, absolutely. So that's part of the case management. We're always working with medical doctors.
Okay.
You know, there's different oncology things and various intricacies if we want to get into the weeds. But the big thing is we have a collaborative approach. We've got a team unit that's working on those cases in most situations, and we're still seeing successful results in the end.
Okay. And you don't just do one thing, because there's a trend here in California where our studio is, where you go in, they remove all your teeth, and then give you teeth supported by implants. But you say you save teeth whenever you can.
Absolutely. Yeah. So the biggest thing at our practice, we're not just take all the teeth out, automatically go to a dental implant supported new set of teeth. We're going to look at each case individually.
Okay.
Our practice is offering everything from cosmetic dentistry, your general fillings, crowns, bridges, everything, even root canal.
Because you have other dentists that work there. They do a lot of that stuff. Is that right?
Absolutely.
You kind of focus on the implant stuff?
Yep. So I've kind of transitioned to just all surgical based. That's where the majority of my training was. It's what I enjoy. It's what I truly excel at. But we've got doctors that have gone through advanced endo treatment or root canal treatment, so they're able to provide that to patients. We've got doctors that have gone through Invisalign training, that way they can perform orthodontics. We also have doctors that are doing enhanced CEs in cosmetics. So we've got everything under one roof with highly trained docs, great facilities. We want to make this a totally different dental experience for any patient that walks through, regardless of what your need is.
Now, Medicare, Medicaid, does not cover really dental implants. Is that true?
That is correct.
Okay, but people have payment plans. I mean, you have payment plans.
Yep. So we've partnered with local banks in order to do basically a medical loan or a medical financing. They work really, really well with us on those ends. We do offer some different payment plans and also like pay-as-you-go for portions of the treatment. Ultimately, we don't want cost or finances to be something that inhibits you from gaining what you are seeking to gain in life by taking this plunge. And
now, even the best dental insurance out there really doesn't cover the whole, it only covers a very small part, right?
Right. And we actually
max payout like $1,000 a year kind of thing?
Yeah, you're usually seeing about $1,000 a year for that dental insurance. I always use the term coupon. Dental insurance is a coupon.
Okay.
You are going to have a treatment performed, and that dental insurance is not quite like medical. It kind of is inverse, right? So it might cover a crown or 2 crowns or maybe some fillings, some cleanings. If anything, you look at it as you're going to at least get that value off of your treatment. Okay. We just go from there.
Well, then if implants are so good, as you say they are, why aren't all these denture wearers, would you say tens of thousands?
Yeah, I'd say it's in the tens of thousands.
Like 100,000 in the whole state, at least?
Oh,
upper,
absolutely.
lower denture?
One of the studies I just saw actually in Nebraska says that long-term care facilities, at least 50% of the people in those facilities are considered edentulous.
Okay. That means wearing an upper lower denture.
Absolutely, yeah. They're
so if it's so good,
teeth.
Why aren't they all doing this? What's your take?
The biggest reason that we're seeing those people that are in dentures don't come to the dentist.
Okay.
The only time we see them is if they're coming in because they need an adjustment on their denture that's rubbing or maybe feels off or is feeling weird. The second reason might be they're just not aware that they're a candidate because they were told previously they don't have enough bone, they don't have, proper age, they've got this health concern. They've already kind of self-selected themselves out instead of seeking what they're wanting. They're just taking what they were told maybe long ago. The third thing, they might have been told they're too old, which we've said that's not the case anymore. That's a very old school type approach. And finally, the fourth one is usually cost. People stop pursuing it because they think, oh, I had 32 teeth. That means I'm going to have to be getting 32 implants and all these different teeth on them, and I just can't afford that. The techniques now, you don't need an implant for every tooth you're missing. There's ways that we can restore a full set of teeth with 4 to 8 implants, somewhere in that range.
So like per arch, like 4 to 6 implants per arch?
Yeah, so we're looking
the lower
usually
and the upper?
We're usually looking 4 to 6 implants on the top, 4 to 6 implants on the bottom.
Okay.
Each case is a little different. If there's certain physics or structural reasons to add more, we will. But again, we're looking at each case on an individual setup, and our ultimate goal is getting that new set of teeth.
Now, if there was like a weekend, like you ran an ad, hey denture wearers, hey people with bad teeth, we're going to give you a brand new upper lower set of teeth just for the weekend. I know that's not possible, right? But do you think anybody, after having test driving them for the weekend, could go back? bad teeth?
Absolutely not. It'd be like trying to have that dream vehicle that you've gotten to test drive around or use as a rental. You're not giving those keys back. You want to keep that.
So and you say that sometimes, I think you told me this on the phone, that you almost can't recognize them, like when they're back 4 months later, 6 months later.
Yeah.
Because they've changed.
Yes.
What do you mean?
The biggest thing you'll notice is as soon as they come walking in, there's times we've had to ask a patient for their name, even though we've been seeing them for months on end, because they're wearing nice clothes. They've got a bounce in their step, and they're dressed to the nine. They've got their hair done. They've got nice clothes on. They're over there chatting away to one of the little old ladies, waiting on her husband. Half the time it's like I'm trying to get the guys to stop hitting on my office staff because they're just chatting away,
Is that right?
trying to take some selfies. Yeah, it's pretty amazing to see how much of a confidence factor you can gain just from your new smile.
So in all of dentistry, this is like the happiest group of patients when you take somebody with bad teeth and give them brand new teeth.
Yeah, it's a game changer. It's a total night and day difference.
So you travel all over the U.S. learning implant dentistry.
Correct.
Is there that much to it?
There's quite a bit to it. There's a reason that you want to be highly trained so that when patients are coming in, you're able to take care of maybe those difficult cases that another doctor said, oh, there's no way we can do it. The more you can enhance your skill set, the more people you can help, and the more lives you change.
And so when they go in for the consult, how soon or how long does it take for you to say, you're a candidate, you can do this? Like how much evaluation do you have to do to tell them yes? You qualify.
I usually like doing some form of an intraoral, just evaluate in the mouth, right?
Okay.
I usually try and get a 3D bone scan at our office. We're not charging out for those. We just want to know what is there, what can we work with. A lot of times I'll actually treatment plan the case right then and there during the consult just to make sure it is something feasible. And then we'll run through and say, these are the steps we'll need to do. Not every case is as simple as just putting in an implant. Sometimes you do have to grow bone back, or you have to, kind of modify your approach or plan things out. Go through that with the patient. Usually you can explain how many steps, what processes are involved, and this is what it would take to do it. Let's either hit the play button or, think it through.
Now, you're a dentist, so you probably think like the smile or the teeth and gums are like the most important thing. How important is it?
I mean, me being a dentist has nothing to do with how important that smile is to every single person walking around. So there's a specific article asking, what do you look for in a partner?
Okay.
You would assume, obviously, the abs or maybe a chiseled jaw.
The physique.
The physique,
okay.
Right? That's what we're all going for. Turns out a smile, consistently, that nice smile is in not maybe the top 1, 2, or at least 3 spot in almost every survey they've done. It speaks wonders. That's not just a physical attribute, that's your confidence that's being shown through. We've got the nice clothes on here that's covering the majority of everything else on your body, but that smile is always showing. You brought up I played football, like we were talking earlier. Even on that football field, you can see all the way across the other side, being 50 yards away, you can tell if someone's smiling or whatever it might be. You can still see that smile shining through and being able to see, are they happy, are they sad, what are they holding themselves like? There's a reason that the people that have that smile, teeth showing, they've got the confidence factor versus the people that just have it down and are looking away. Simple teeth, simple smile.
Now, you say people with bad teeth are judged.
Absolutely. Obviously being here in California, the movie industry is right next to us.
Yeah.
Tell me how many of those villains that you see in a movie or any of the...
They have darker teeth.
Absolutely.
Yeah,
They're always darker, or maybe you'll see, more of the low intellect type character that's got a tooth missing. Why do they do that? Why do they focus on the smile telling the story? It's because
a homeless person or street person.
Yeah, absolutely.
Give them bad teeth.
Absolutely. There's a reason they do that. We're hardwired. Your brain is just an amazing machine. It's taken all these different things that are in your surroundings, computing them, giving you a predisposed idea of what's going on, or maybe a gut feeling, shall we say.
So they feel judged? Did they ever tell you that?
Oh, absolutely. Yes. I have so many patients that'll come in and say, I feel so ashamed because of my teeth, or I feel like I'm looked at as lesser than just because of a smile, or because maybe my teeth can be as simple as maybe you've got really prominent canines or the pointed teeth. You get made fun of for, being a vampire or something like that.
Yeah.
It's enough to make you kind of pull back into your shell. Even little insecurities. Think about anything that you don't like about yourself. You're going to focus more on that so that every time you walk into a room, even if nobody's looking at, I mean, I've got Czech heritage, right? I've got a little more prominent nose. If I was to walk in and be concerned about the size of my nose in every single room, it'd make a guy just really pull back. The same thing happens to any other physical attribute that you have.
So when you hate your teeth, it holds you back.
It absolutely does.
So you see that change. So you give them brand new teeth and they're acting differently, like more charisma?
Absolutely, yes. They're sitting there.
They're more approachable?
They're approachable. You're able to talk with them. You see a confidence factor. I already told you that seem to be always trying to flirt with my staff. It's just a night and day difference.
You say you don't judge them.
No.
And some patients will say they're always getting lectures from dentists. I hear that, by the way.
Yeah.
People will say, I got lectured at the dentist. But you say you don't lecture.
I always tell people as soon as they're sitting in my chair, I don't care about what happened in the past or what was done or not done or where you feel you failed or succeeded. Ultimately, once you're in my chair, my only goal is for you to reach a satisfactory result, and we're moving forward.
Good. And you say it's like a bacterial infection anyway. So even if they're trying to brush it or floss it or gargle it out,
not going to do it.
Not going to do it.
We got to fully remove that bacterial infection. In a case where somebody is able to save teeth, we've got ways of doing a deep cleaning to kind of take care of that. We've got medicated, rinses and stuff that we can help. But there are certain cases where that's advanced so far. Your only route is basically removing that infection, removing that the teeth, and removing anything that's compromised. We just have to go to a new slate. And
so you're doing this like every week.
Every day, it seems like we've been.
It's very busy.
We're very busy, which
now,
is a great thing.
Is your goal to be like Nebraska's premier center for implant dentistry? I'll put you on the spot here.
Our goal is to be the spot. We want to be the spot in Nebraska. Yep. We're like I said, providing everything under one location, under one roof. We're basically there to save people's teeth when we're able to. We're also there to be able to give you a new start if we can't save them. And not very many places in the country, and especially in Nebraska, are able to offer all that in one spot.
We're out of time. So final message. Somebody watching this, they're of the two categories you talked about. They're either wearing a denture or they have really, really bad teeth and they feel like they're going to end up in a denture. They've heard what you have to say, but they're still afraid or skeptical. What do you say to them?
I'd tell them, come on in.
Okay.
Let's see what we can do for you. Let's give you that fantastic guest experience of evaluating your options, being treated, well, being treated like a person, not being judged. Come in, let's see what we can do for you, and we'll move forward from there.
Okay, good. So what's the best way to make an appointment? Do they just go online or call your office, or
what
do you prefer?
We offer everything from online scheduling to where they're able to just hop on the cell phone or on the computer, jump on there, make an appointment, or just give us a call. Give our office a call. Tell them, hey, saw you on the show, looking to see what you can do for me. Our front desk will set you up with a consult to get you in and just see what your options are.
Okay, good. I want to thank you for coming on the show. Good stuff.
Yes, absolutely. Pleasure.
Appreciate it. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.